Hello dear patients, today we are going to talk about the case of coronal sulcus erosion. A young man came to us, and in him, almost painlessly, with a slight feeling of paresthesia, pins and needles, chills, erosion appeared in coronal sulcus. It was a bit more dense than the surrounding skin, however, generally speaking, such density was hardly visible. So during observation we suspected traumatic erosion and staphylococcus, as well as herpetic erosion, etc. It's no doubt that here diagnostics is important for erosions of penis, in particular external diagnostics using a smear method. This is also a culture test from the surface of erosion. These are analyses for sexually transmitted infections such as herpes of different types. We mentioned this in a separate videos that you can watch on our channel. That is also syphilis and other sexually transmitted infections that were checked from the surface of erosion as well as from inside the canal. These are candida as well. It's also bacterial culture test, as I said before, and blood test for such infections as syphilis, herpes. At least herpes of second and first types have to be checked, as well as immunoglobulin G, etc. In this case, analysis for Treponema pallidum were positive. This is a causative agent for syphilis. Usually hard chancre is an ulcer, however in this case this was an ulcer that existed for quite a long time, for about 20 days already. It didn't grow, it didn't change, and as I already said, it didn't bother the patient much, apart from sensations of paresthesia. Rapid plasma regain test, the main blood test done in polyclinics, was negative. Then we took blood for total antibodies, and we did other analyses, some of them were positive. This indicates a fresh infection. By the way, at first the patient denied having any casual sexual contacts. Then he remembered that he had oral sexual contact, and he even did not consider it as a sexual contact. It was with an unknown sexual partner, and he got infected by syphilis. What is important to mention here, it has to be said that blood analysis in some cases, as in this one, did not give any positive result. It's very important to take external analysis, such as scraping, smears, that are often not taken in dermatovenerologic dispensaries, where he went and he was set a diagnosis of herpes, and internal acyclovir was prescribed without any effect. Therefore, here it's important, before treating any erosion, to set the correct diagnosis. It would have been worse if this erosion had been treated by some antibiotics or ointments, as is often done by so-called experienced specialists. Then it would turn into a secondary stage of this disease. If it is necessary to diagnose and treat any rashes in the area of penis, you can consult venerologists and urologists of our paid medical center of Dermatovenerologic Dispensary in Moscow. We have experienced specialists who do diagnostics and treatment of such rashes. We are waiting for you in our clinic. Please subscribe to our channels on YouTube and Instagram. Thank you for your attention.